Are you unsure where to start with all the anti-aging treatments out there? There's an awful lot to choose from and it can be a little bit overwhelming. The first thing to do is to get a good consultation with a medical professional who can help guide you. So let's break it down. First of all, wrinkle relaxing injections. Often used, the term used is Botox, and this is great for relaxing muscle movement, so it's good for crow's feet area, for frown lines, for forehead, but we can also use it in the lower face and it can help to tighten and lift the jawline, and also we have a Nefertiti neck lift. Then we come on to dermal fillers. They're usually made of hyaluronic acid and they are used to replace lost volume. So they're good for the cheeks, for helping restore lost volume and tightening the jawline. They are good for nose to mouth lines, downturned corners of the mouth, and of course the lip area, and also the chin. So you can use them to sort of sculpt and lift the face, but you do need to be careful not to overdo it so that you still get a nice natural appearance at the end. Then we've got skin boosters. Skin boosters are like injecting hydration, if you like. So it's like injecting your moisturizer. So you're hydrating from within for really lovely, glowing, smooth skin. Then we move on to polynucleotides. Polynucleotide has been a growing trend over the last couple of years, sometimes referred to as the salmon sperm facial. And it does indeed come from salmon sperm or sometimes trout. And this is great for working at a deeper cellular level to restore the cells and to make the skin like younger skin. So you're going to get skin tightening, it's going to help with pore size, fine lines, and it's just going to make everything look fresher, and it doesn't change the shape of the face, which is so useful. So for years we've had Botox and fillers and that's about it, maybe a few sort of skin treatments, but nothing that really works in the way that polynucleotides do. So they're a real game changer, really good for the eye area. So when you've got thin, crepey skin around the eyes, or tear troughs, dark circles, even above the eye for hooded eyes, you can have a course of polynucleotide, and this will help restore the skin to how it used to be when you were a little bit younger. So that's a really great treatment. You can use them all over the face, neck, décolletage, back to the hand, anywhere on the body. And then we have microneedling. Now microneedling is also regenerative medicine. So it regenerates the skin and it boosts collagen, but it's been around in aesthetic medicine for many, many years. But it's a great treatment for inducing a little bit of controlled wounding so that you then get controlled healing, which means new skin. And this is good again for fine lines, tightening, but you can supercharge that with something called exosomes. Exosomes, which actually comes from cow's colostrum. So we've had salmon sperm and trout sperm, and now we've got cow's colostrum. And we use that while we are microneedling over the face, and that really supercharges everything for helping to help with collagen levels, and again that skin tightening and glowing skin and pore size. And you can target specific things such as pigment, and that's a really great new treatment. So where you start depends on you and your skin. So if you're unsure and you would like to book a consultation with me, we'll take it from there. Thank you.